I'm Alex. I'm a reporter at the Daily News. I want to thank all of you for joining me today. Let's see, on this side of my screen, I've got Elaine Placido and Dave Lefebvre. Could you both introduce yourselves a little bit and tell me your role in the county?
Dave Lefebvre. I'm the fire chief with Cowlitz Fire and Rescue, but in this situation, I'm acting as the incident commander for the Cowlitz County response to COVID-19 issues.
Hey, Alex. I'm Elaine Placido. In everyday life, I'm the Community Services Director for Cowlitz County. And in the IMT, I'm serving as the Health Branch Manager.
Cool. And Steve, I've got you here. Could you introduce yourself and tell me a little bit about your role and your credentials?
Yeah, so my name is Dr. Steve Krager. I am the Deputy Health Officer for Cowlitz County. So the health officers kind of serve as subject matter experts for an incident management team, and then advise the health department when we do investigations during an outbreak, that sort of thing.
Cool. And you're also the officer for Clark, Wahkiakum, Pacific, and Skamania counties, right?
That's right.
Gotcha. So you got kind of our whole area.
I do the whole, yeah, so all of Southwest Washington, basically. Cool.
Well, about 75% of my questions I think are going to be directed towards you, but and we'll start there. But Dave, Elaine, you guys feel free to jump in, and then near the back half of this video, I guess I'll have questions more directed towards you guys. But all of you feel free to jump in if you feel like you have a good answer. So just to start off with, I've kind of broken these up into categories. I want to start off with just kind of general public health advice, and kind of pick your brains. Some of these questions people have about what they should be doing to stay healthy. The first has to do with masks, and I know there's been some reporting very recently about considerations by the CDC to recommend that people wear masks. So just to start off with, should the general public, if they're going out, should they be wearing masks? If so, you know, what kinds of masks, what quality? I mean, what's some advice you have on that front?
Sure. So I wish I could give you a super straightforward answer, but it's a little bit complicated, unfortunately. So right now, we're not advising that everyone who goes out needs to wear a mask. We especially want to keep like medical masks, so the masks that our healthcare providers wear, surgical masks and N95s and those, we want to keep those in the hands of our healthcare providers. Unfortunately, we've had shortages, and so that's an important, you know, piece of this, is that we want to keep them protected. They're the ones who are interacting with the most people with this disease, with COVID-19, in the closest proximity, so they need to be kept safe. If you do, you know, decide to wear a mask, the evidence is a little bit mixed as to how much it's going to help. It's certainly not going to hurt for you to do it. The key are a couple things. So it doesn't replace any of our current kind of recommendations in regards to social distancing. So if you are going to wear a mask, you still need to stay away from people in public as much as possible, at least 6 feet away. We still want you to limit trips. We still want you to, you know, do only the essential things that you need to do and still stay home as much as possible. The other point is, if you wear a mask, is that some people, when they're wearing one, it itches or it's not fitting correctly, and then they end up touching their face, and that's, again, kind of the opposite of what we want people to do. So if you're going to wear a mask, wear it correctly so that it covers both your nose and your mouth. Make sure it's kind of tight fitting, and that try to avoid touching it as much as possible. And those are kind of the guidance that we're putting out. The CDC may release more guidance going forward, and so we're waiting to see what they have to say too.
Gotcha. So it sounds like if people have kind of hospital grade N95 masks, it's the preference maybe for them to give those to hospitals if they can, because they're, you know, they're more valuable, I guess, for healthcare workers, first responders.
If they can, and if they feel comfortable doing that, that would be wonderful. I know our county in Cowlitz is taking donations from the public. and the chief and Elaine can talk about that a little bit. The only other exception I would say is if you have someone in your house, for example, that has tested positive for COVID-19 and you are providing some sort of care for them, so providing them some meals or being in close contact with them, then it's okay for you to wear a mask during that, and that's a good way to keep yourself safe.
Gotcha. So we don't fully know exactly how much they help, but it does sound like it can provide some benefits to people.
Yeah, and I think that the most important thing is what masks do, at least the kind of like cotton ones or ones that are homemade, they keep you from spreading germs out. They might not do a whole lot from you taking germs in, but what we've learned about this disease, unfortunately, is that people can spread it before they have symptoms, up to 2 days before they have symptoms. So you might have the disease and might not know it. And so in that case, it might make sense to wear a mask if you're going in public to actually stop yourself from spreading it.
Gotcha. Cool. Thank you. One question we had, a few people were asking about just how easily the virus can spread. If people are practicing social distancing, if they're keeping that 6 feet away from other people, if they're washing their hands, staying hygienic, what's kind of the concern? And specifically, one person said, if I walk past someone who's infected and neither of us cough or sneeze or spit, but we just walk past each other on the sidewalk, could I pick the virus up that way?
That would be extremely unlikely. What we see is that most cases are from, we identify a known case that had it and then passed it to someone else. And it's usually like a household member or someone that spent a significant amount of time with someone in an indoor capacity. So I would say the chance of, walking past someone and getting sick from them is extremely low. There's a lot of airflow outside. So even if they, cough or are talking and kind of pass some of those droplets that kind of come out of our mouth as we speak or as we sneeze, the chance of that landing on you and you inhaling that is pretty low.
Gotcha. And that, maybe this is a dumb question, but that's how it has to be spread. There's no way that, you could be next to someone and if it didn't have a kind of a biological way of transmitting, that's, as far as you're saying, as far as we know, that's kind of how it gets from person to person. Yes,
and there's a lot of research going on to find out exactly how it's transmitted. We know for sure that, so most of the time it is transmitted by what's called droplets, so respiratory droplets. So you create the most of those when you sneeze and when you cough, but you create a little bit as you talk. But generally, especially just from like talking with someone, you have to be in very close contact to be close enough to those respiratory droplets to inhale them or to breathe them in. The other concern is, with surfaces, and that's kind of two ways. So someone who's sick could touch their face, touch their nose in some way, get germs on it, and then touch a surface that has it. Someone who's sick who is also coughing and breathing in kind of an enclosed space, that enclosed space might get some droplets on it from you coughing and breathing and talking and that sort of thing. But usually it's not traveling very far.
Is there any way, some people have used the word airborne, is there any way that, the viruses could like scatter on the winds and that if you're out walking outside, it could just ambiently come into contact with you?
So what we do know is that it's not nearly as infectious as some things like measles and tuberculosis. So those are truly known as airborne diseases. They can linger for hours in the air. And what we know with COVID-19 is that these respiratory droplets, they can linger for a little while in the air, but most of the time they will drop to the ground. There was one study that I read that, found some evidence like a couple hours later, but this was a very controlled environment where they used a machine to kind of aerosolize and spread the virus very efficiently. And then they found pieces of the virus, but they didn't necessarily find a whole virus that could infect someone. So what we don't have is evidence that, for example, someone in a room breathing, talking, even coughing, like 2 hours later, we don't have evidence that they could, that breathing in that air could be infectious for someone that, that far away from that person being there.
Gotcha. Okay, well, that's good to hear. Let's see here. Oh, and then I guess I kind of asked you a two-part question there. So the first part was just, in general, how concerned, as long as people are following the CDC recommendations, what level of concern should they have about going out in public?
Yeah, so I mean, any time going out in public, you might have some passing interaction with people. I think I would also, be concerned just about surfaces in public as well, and that a lot you can handle by washing your hands frequently, especially after you've touched things, or using hand sanitizer if you don't have a sink nearby. But we do want people to limit trips as much as possible. So try to go to the grocery store only if you have to. If you have, if you're elderly or have some chronic medical conditions, maybe ask someone else to go grocery shopping for you and you stay home. But yes, if you are kind of following those recommendations as much as possible, the risk should be low. But we are, we're finding more cases, and it's unfortunately kind of a sneaky virus in that, yeah, people are potentially passing it without knowing it. And then we have this lag time with testing where, someone gets sick, they may have mild symptoms for a week. They're, not going out, but they're still interacting with their household. Their symptoms get worse and they get tested the next week. And then, we don't get the test result back for another few days. By that time, they unfortunately have interacted with people in their household quite a bit during their infectious period and likely have already infected them. So that's most of the infections that, we have seen. That's kind of been the story with them.
Gotcha.
So what I would say is, as much as possible, like if you are around someone who is sick, trying to limit contact with them. If you are sick, trying to limit kind of with any sort of respiratory illness, whether it's mild or not. If you have any sort of fever, cough, sore throat, congestion that's not due to allergies, trying to limit contact, trying to wash your hands as much as possible, trying to not share utensils and glasses and those sorts of things to prevent spread from, those close household contacts. Gotcha.
Cool. Let's see. This is maybe a question that we can bring Dave and Elaine in on a little bit. One person had a question about grocery store workers, restaurant workers, other people who are kind of in essential businesses that are public facing. Should they all be wearing personal protective equipment, especially, let's say you've got someone at a drive-through who's taking credit cards and handing food out. Is it a good idea for all those people to be wearing gloves? To what degree should some of our some employees in those industries be kind of fully suited up?
You want to speak to that?
Sure, I can. So
I can as well if you want.
I'll follow up after you, Dr. Schrager.
Okay, sounds good. So with gloves specifically, I would say, obviously food handlers, when it's appropriate, should be wearing gloves when they're touching food. Otherwise, kind of handing things back and forth, gloves are really only protective for kind of that first touch. So if you think about it, I mean, if you, wear some gloves and then you touch someone's credit card, unfortunately, those potential germs on that credit card are now on your gloves. So you'd have to change your gloves a lot to really to be protected in that way. So I think what's more practical is to do hand washing, frequently. So anytime you're touching something that's not yours, kind of having that interaction, I think it's appropriate to use hand sanitizer, wash your hands Gloves, again, can offer some protection, but just try to be conscious of what you're touching with them, and how many other surfaces you might touch. It might not be offering you the protection that you might think.
Gotcha. And Elaine, did you have anything else to add?
No, really any additional stuff to add. I think it's important to know that we're sharing good guidance with food workers and employers all around the county through the PIO, including some recent questions about the food worker questions. There's a lot of concerns, and we want people to keep going out and getting takeout if they have the opportunity and to feel comfortable about that.
Cool. Gotcha. Okay, the next few questions here are on testing, which a lot of people had questions about. First of all, and so this will probably bounce between, I think, all three of you. The first question, do we have anything in the works right now to get more tests available here to improve test kits? I know Peace Health has some stuff that they've got in the works. Do we have anything outside of that to improve our testing capabilities?
Well,
Oh, go ahead.
well, one thing we are doing is, and I don't know if this, I don't know what the success of this will be, but we are requesting more capability through the state EOC. So right now our emphasis is developing improved testing capability for first responders, healthcare providers, because, you know, that is the front line effort with this. So, but also keep in mind, I think there's a number of myths about testing and test kits. If a person's not showing signs and symptoms, there's no reason to test. So there's, in some places, and some thought is we should be testing everybody. If we would just be using up the testing capability, because if people aren't showing signs and symptoms, then there's nothing for us to be testing for. So right now our testing capability here in Cowlitz County has been pretty good. We haven't had, I believe we have 4 locations that are testing, and then we're establishing a mechanism for first responders separate from that. So we haven't been pressed on that issue from the facilities and operators that we're supporting.
And additionally, so working with my team over at the health department, we have a testing mechanism in place for long-term care facilities. I know that's a great concern to people. So that mechanism is set up, and we're able to share test kits with them. And they have a process already in place working with the communicable disease team over at the health department. And we also are able to share some tests with some local healthcare facilities. As Dave said, there's 4 facilities in the county that are currently set up and testing patients on a regular basis.
Cool. Steve, anything to add to that?
I think I would acknowledge that there is a little bit of frustration with at least that I've heard from the public in not getting tested, and I think what is in part of that is that there has been some limitations in supplies. People, there's been a huge demand, so even something as simple as the swab that you need to do the test, it's been a little bit harder to find. But we are finding more, and we're getting them out to healthcare facilities and long-term care facilities as much as possible. We want to find more cases. We know that, you know, the cases we have tested positive, we know there's more that are out there, and that is not, you know, that should not be taken as the definite amount of people that have been, you know, sick with COVID-19 in Cowlitz County. We want to know, especially people that are at higher risk of developing complications as well. So I would, yeah, you know, healthcare providers, first responders, those are super important, because we need to know we don't want those people to be spreading the illness, and we don't, you know, and we want to get them back to work as quickly as possible. And then with people who are kind of at higher risk, we want to know, we want to keep them from spreading. And so a long-term care facility, which is, you know, a dangerous potential place for a case. So like what we saw in kind of the Seattle, Kirkland area, they had several long-term care facilities, one in particular that had a really bad outbreak and a lot of people had poor outcomes. That is definitely something we want to prevent. If we, you know, we want to find a case as quickly as possible and then do as much as possible to keep that person safe and keep them isolated from other residents. Make sure everyone who is interacting with them has the protective gear that they need. So yeah, those are our priorities in terms of testing.
Gotcha.
Uh,
Yeah, go ahead.
Can I add something to that? Since we're talking about testing, one thing we have seen that has helped a lot is the time frame in which we get results back. So 2 weeks ago, it might have been 8 or 9 days before we got the results back. Now we're getting results back on average in 2 to 3 days. And as some of the technology comes forward, of course, it will be limited, but we have the potential of getting results back within 14 to 40 minutes. So that is helping this situation quite a bit. I know it's not a cure or a vaccination, but just getting those results back in a more reasonable time frame has a huge impact. Number one, on our ability to keep responders and health workers engaged in this fight. And then the other is, the doc just mentioned, is the sooner we know if it is positive, then that's critically important. But something else to keep in mind is that in the state of the 70-some thousand tests that have been done, about a little over 6,000 have come back positive. That means that 93% of the tests that come back are negative, even on someone that's showing signs and symptoms. So one thing is, everybody that's sick is not sick with this virus. It's flu season. There's a lot of colds. There's a lot of issues out there. And the main thing, and the doc mentioned this too, and I want to reinforce, and maybe Elaine did too, if you're sick, stay home. If you're sick, stay away from people. And that's just something that needs to be a part of our society.
You like, even past coronavirus, if you're sick, you're saying that's got to be kind of maybe a societal change that we take away from all of it.
Yes, because we have huge issues each year with influenza, significant issues. And so these lessons are not new at all. Technology has changed some, and we're looking for breakthroughs with vaccines and stuff. But in reality, the best tools we have are for us to recognize that we don't feel well and to stay away from people.
Right. Gotcha. I've got some kind of number questions here. So maybe this will be a question for Steve. What's our current daily testing capacity on any given day? How many people are we able to test?
That might be a better question for Elaine, and I'm not sure of the exact numbers off the top of my head. Let me look and see if I have it easily available, but I'll let Elaine and the chief answer that if they know more.
You look at state statistics every day. I think it's easier to reference those. Right now, they're averaging between 200 and 300 tests a day, which gets us to the number we're at right now, which is about a little over 70,000 that have been tested since we started these operations at the state level. I'm not sure what our local testing level has been.
So it fluctuates, and we don't ask how many tests they've completed each day, but we ask them what their daily capacity is for testing. And by they, I mean healthcare facilities that are doing testing. And so there's a wide range. You know, Peace Health obviously has a larger capacity for daily testing. Kaiser is doing testing. We've got some smaller healthcare clinics that, you know, have the capacity to do 20, 25 tests a day. They are not doing that many tests per day because they're limiting to people who are actually sick. So I think we have a larger local capacity you know, maybe a couple hundred tests per day, but they're not actually conducting that many tests per day.
You say that they're limiting the amount of tests they conduct because you're focusing on people who are sick, who have symptoms. So does that mean that they have enough tests that they could be using them on people, but they're kind of saving them again? So like, let's say, hypothetically, we have capacity for 200 tests per day in the county, hypothetically speaking. Does that mean that every day we would have like 200 tests that we could use, but we're just not using all of them because we're waiting for people with symptoms? Does that make
So
sense?
Dr. Krieger probably will have a good follow-up on this one, because I'm not that kind of doctor, but what I gather from our providers is they start with ruling out the other, flu and other respiratory diseases that could be causing whatever the symptoms are. So, they start with that. If those are inconclusive, or, they've ruled out those other things, then they can move into COVID. They're still focusing on people with symptoms. So I guess you could say, yes, they could test more, but, without more information, I don't know if they have, if there's people there that need to be tested that have already had everything else ruled out. Dr. Krieger, is there something you can offer that's more helpful?
Yeah, well, I don't know, maybe. So we've kind of given the same guidance that the state has given in regards to kind of who to prioritize, and definitely someone who is symptomatic is going to be a higher priority. I don't think we've done really any asymptomatic testing of anyone, people without symptoms. And then from there, and right now, public health makes recommendations, but ultimately it's up to the provider to decide who to test. So, and a lot of those providers are working under their facilities kind of policies. So either their clinics policies or their hospitals policies. But what we tell them is, test people who are sick, test people who have more severe illness, test people who are in healthcare settings, first responders, public safety people, test people who are in kind of institutional living, long-term care facilities, shelters. And we also, still tell people to test. We recommend testing people in public-facing occupations, so grocery stores, pharmacies, gas stations, those sorts of things. And then in addition, people with higher risk, so patients over 60 years, people with underlying health conditions. Those are kind of, the recommendations that we give, and then what healthcare providers do with that is somewhat based on, yes, their capacity, but also what they're seeing kind of in their day-to-day operations.
Gotcha. So, so when we talk about the testing capacity, I guess when we say we're focusing on these people, bottom line, does that mean that we have maybe more tests, but we're being critical, I guess, about how we use them, and to try to make sure that the amount of people we test has as many actual positives as possible?
Yeah, and I think there's still some limit, sorry, I was just clicking on something.
No problem. I think we all got the same notification there.
Yeah, the same little notification. Like, what happened? There still is limited resources, so I think healthcare systems are still being a little bit, picky and choosy in terms of exactly who they're testing. If that capacity, greatly increases, you might see that healthcare providers and systems are opening up to, to more people that have more mild symptoms, more people that are less at risk for kind of severe illness. But even then, most of the time, we want those people to stay home. Honestly, we want them to stay home and not expose other people. So it kind of depends on what the healthcare system has in terms of their testing capacity. If we had some sort of drive-through clinic, which we don't have right now, but if that was easily available and we could test people without exposing other people, that would be another potential option. But we don't have that right now.
Right. Gotcha. This is another question that I think all three of you might have some input on. And I think we've asked you this before. Stephen had a little bit in the paper, but it might be worth expanding on. A lot of people are asking, can we get more information about the people who have tested positive, where they live, where they go to work, maybe where they've been in the past 2 weeks before they tested positive. And it sounds like there's a reason why that information isn't being released. And could you all kind of explain why you're not sharing that information?
Yeah, of course. So there's a few different reasons. First of all, when we get a positive case, our investigators, which are our nurses at the health department, are doing an amazing job. They do a very in-depth investigation with these cases, and that includes an interview with the person and people around them. And yes, they find out, exactly where they went, who they had contact with over the last 2 weeks. What we've been seeing recently is that, most of the time people are staying home, which is great. So the amount of contact they're having with people is more limited, and mostly just the people in their households. And then if you did have close contact with a case, you would get a phone call from the health department. So in close contact, we define as kind of like healthcare contacts without appropriate PPE, close household contacts, spending about 10 minutes with someone within 6 feet, that's considered a close contact. And then being kind of like having an interaction where, for example, you were directly coughed on by a known COVID positive patient, those are considered close contacts as well. So if you were a close contact, you get a call from the health department, and we would tell you, okay, you were exposed to COVID-19 on this date, let's say like a week ago. So from now on, we want you to be watching your symptoms. Please call us if you get symptoms, or call your healthcare provider. But you need to stay home. And what we tell people to stay home for 14 days after that last exposure. And the reason we do that is we know that about 14 days is about the longest that you could develop symptoms after exposure. So that's kind of like the incubation period. On average, it's 5 or 6 days, but we go up to 14 days to be extra careful. So that's part of it. We are doing that investigation. The reason we're not naming kind of like public locations is we don't think that it's a strong vector for passing the disease. And we also know that the virus is out there, and we don't want people to have kind of a false reassurance that, well, I wasn't at the Albertsons, for that half hour that person was there, so I'm okay. Well, you should be honestly being as careful as possible and treating that as kind of any public exposure as a potential. And so those are kind of the main reasons. The other main reason is that, kind of as I mentioned before, it's not as infectious as something like measles or tuberculosis. In Clark County, during the measles outbreak last year, they did name public places, and that is because measles is known to infect people in public places if someone spends even a small amount of time there, and we don't have good evidence for that with COVID-19, and we don't want to give people a false sense of kind of reassurance.
Gotcha. Cool. Dave Lane, anything on that kind of subject?
I think it'd be pretty hard to top the doc on that.
Right.
All right, fair enough. I'll kind of keep a good clip here. There's a million questions I could ask, and maybe I'll send some of these over email to all of you, but to keep hitting the highlights. To talk about the status of the virus itself, how are we doing? I mean, has the social distancing that we've all been practicing for the last about 3 weeks now, is it working? And what kind of projections do you have for Cowlitz County? And is there a light at the end of the tunnel for us?
Mm-hmm. Yeah, it's interesting. I was just on a call where we had it was a call with the state, and we had one of the researchers from Institute of Health Metrics and Evaluation, which I think is in Seattle, and that was actually what they did the modeling for the whole country that I think the president talked through. And they were specifically talking about Washington State and kind of their projections going forward. And at least in Washington, I think the initial kind of projections that we have, and with some more recent data, is that we have done a pretty good job of flattening the curve. We are not seeing as severe a spike in cases that we worried about. And we also, we unfortunately are seeing people dying, but it's not as severe a spike in that rate as well. We can take some hope from that, I think. The unfortunate part of that is that it might cause this to last a little bit longer. That's kind of, if you've ever looked at those pictures, kind of comparing, a very steep curve up and then down. It's kind of a shorter amount of time, but I'll kind of, when you flatten it, it gets a little bit broader and wider. And that may make it last a little bit longer overall. That saves our healthcare system from a potential, overuse of resources where the healthcare system gets overwhelmed, and is better able to handle the cases that we do have. So that is some good news that we've had recently. It's a little too early to say that, that we for sure are kind of past any peak. In fact, we're not past the peak yet, but we're seeing some projections that the peak won't be as bad as it could have potentially been, which I think is great. Right now across Washington, we don't have Cowlitz specific data, but they did say that they were working on some county specific data, so we might have some projections soon. But at least across Washington, the peak is estimated, I believe, in about 8 days. That was kind of peak kind of resource use. So across systems, that's when we will see the most kind of daily cases, and then hopefully the cases will start to drop down after that.
Cool. And then kind of related to that, do you have any estimates as far as timelines? I mean, a rough time that we would be able to start going out in public regularly again, a time when we'd be able to start up social distancing and physically be closer to people. Is it possible to kind of make those estimates yet?
I think it's really hard. The governor, extended his order to stay home, I think through the beginning of May, and I think that is a reasonable estimation right now of what we might need to do. And we will know more in the next, 2 or 3 weeks, and we'll probably be able to make more concrete kind of predictions. But yeah, I think it's a little too early to say anything beyond that right now.
Gotcha. Let's see here. The counties that appear to have no cases or very few cases tend to be kind of in the corners of the state, somewhat isolated. We're on the I-5 corridor. We have a pretty moderate to moderate small population compared to the rest of the state. Do you attribute any of that to the fact that we haven't had a huge amount of cases? I mean, does it help that we're a little more rural than somewhere like Seattle? Does it hurt that we're on the freeway?
That's hard. It's hard to know. I think probably both. Yeah, I mean, certainly some populations are more rural and a little more isolated, and I think that does help. And yes, being along the I-5 corridor means that people are coming, especially early on, when there was a lot more travel happening, people were coming through and, coming from Seattle, coming from Portland, and those, that travel just happens. I would caution that, again, our confirmed numbers, there are more, and I would not be surprised that even in some of the small cases or small counties that don't have any, they actually have had a case, but either that person wasn't severe enough to be hospitalized or never went to the doctor to get tested. I would not be surprised if there were cases there, and so people still need to be cautious, absolutely, in those smaller counties. Pacific, I know, is trying to do more testing because they're are also concerned that they've had cases and they just haven't found them yet. So we know we're seeing some evidence that these social distancing measures are working. I would say too that I think people can go outside. I want people to, you know, get fresh air and keep their mental health intact, and but just don't do it in large groups and don't mix with people that you don't normally spend time with in your family.
Right. Now, you mentioned a cluster, I think when you last spoke to our reporter, Katie, that had been sort of identified by the Department of Health. Can you tell me a little bit more about that cluster and how that's factoring into some of your work?
I can't tell you a whole lot more about it. It was kind of just tied to a specific location, and we have notified, you know, the people that are impacted by that location, and we're watching them for symptoms. I don't think we've had any more after kind of our initial investigation with that cluster. So yeah, I don't have a lot more to offer. Yeah.
You're not able to describe any kind of location or information or time on it?
No, and you know, the people that were directly impacted were notified, and yeah, that's the most important thing.
Okay, cool. Let's see here. Just a second here. This is maybe kind of an obvious question. What's kind of the possibility, and it sounds like it is very possible, that the virus had been in Cowlitz County before we started locking down. There were people who were saying, you know, look, I had some symptoms that sounded like COVID back in February or maybe even earlier. You know, is it possible that that was coronavirus at that time, and just we as a nation, we hadn't quite gotten around to really testing everyone for it?
That is certainly a possibility. One of the things we also just learned about recently is that there's going to be more testing, what's called like antibody testing. So, and I don't know exactly when those testing capabilities are going to be rolled out, but hopefully soon, in the next month or so. And what that is going to do is, honestly, it'll be able to tell you whether you had it or not. So, yeah, it'll be really useful, I think. We think that people who have had it at least have some initial protection from getting it again. So, you know, it may play a role in kind of who is more safe to kind of go out and work and those sort of things. Getting ahead of myself a little bit in terms of, you know, but that might be something that we do going forward, is kind of like testing people and say, oh yeah, actually you probably did have this in the last month or two. And right now we can assume, at least for a little while, that you are immune, so you're going to be safe from catching it, from spreading it to other people. So that'll be interesting. I'm kind of interested to see what that looks like going forward. I would not be surprised if, yeah, there were more cases in February that we didn't know about, and we didn't even have much testing capability at all. It was very, very limited. You know, had to be sent to the CDC. There was very strict criteria for how to get tested, and most of it was related to travel. So it's certainly possible that we missed some.
Gotcha. I know we don't have you here forever, so I just got a few more questions here I'll run by you. And actually that transitions us great into just some kind of scientific questions about treatment. Tell me about just kind of the treatments providers are using for COVID-19 patients. And I know in the news we've heard about some kind of experimental drugs like chloroquine, if I'm pronouncing that right. I mean, where do some of these ideas, these so-called, you know, maybe miracle cures that have been talked about, what are we actually using effectively with patients?
Well, we don't know. There's a ton of research going on, both here and internationally, to try to find treatments that work. There's a lot of, like, you know, very initial studies that show that one treatment might work, and then another study comes out the next day that says, it didn't do that great. So I'm hesitant to make any recommendations. I mean, whenever we're studying a new disease and whenever we're studying a new drug, to fight that disease, or even an older drug that we've had around for a little while, like chloroquine and hydroxychloroquine. You know, it's not always the right thing to take it, honestly. It's if there are really no other options, the problem is when we're studying something, we don't know for sure that it's going to help or it's going to hurt. That's why we have to do the research, and that's why we have to, you know, take a group of people, you know, we give a group of people the medicine, the drug, and then we give a group of people, we don't give them the medicine, we give them a placebo, and then we compare the two groups. Sometimes when we do that with medicines, we see that the group that took the medicine did worse. So we have to be really careful about, you know, what we recommend people to try. I would say that if you, you know, if you are sick, you want to try something, I would encourage your doctor to do it as a part of a research study, honestly, because that's the most helpful. That's going to be the most helpful. If you just kind of try it out, we're not going to know whether it really worked or not. You know, you might get better, but you might have gotten better kind of regardless. It's really hard to gather data in that way. So yeah, we will know more in the next, you know, few weeks and months about which kind of medicines work better than others. I wish we had more answers right now so that we could, you know, better treat people who have it. But it's, you know, unfortunately, we just discovered this virus barely 4 months ago. It takes years to develop drugs for certain treatments sometimes. So I wish I had some better news to tell people, and that there is this miracle drug that for sure will work, but we don't have that right now.
Gotcha. And it sounds like maybe there's going to be a similar answer to this question, but what are our prospects as far as something like a vaccine? Is that something that is sort of in that same developmental stage?
It is. I think it will unfortunately be further out than even some treatments. A vaccine would be wonderful, and I hope we have one within a year or so, but every estimate that I've seen is, you know, 12 to 18 months, and that's like a very fast timeline for a vaccine. I hope we have one. I think it will, you know, provide, especially if it works really well, it will be a great way to provide protection for people. But yeah, it's a ways off.
Okay, and then, you know, the last question I have for you before I kind of move over to the IMT side is just any rumors that you've heard swirling around, stuff we didn't talk about that maybe you'd want to address given the chance?
I've seen a couple like really random Facebook posts where people will say like, this doctor from Stanford or Harvard wrote this thing, and it's like this list of kind of I don't know, some of it is actually fine, but then there's other parts that are not so good. I'm trying to think of a specific example right now, but what I would say is, you know, in general, don't just trust a block of text that you read on Facebook. Try to find like a legitimate source. The CDC, the WHO, so the World Health Organization, kind of our state and local health departments also have good resources for people. There's definitely good sources in terms of, yeah, like if you actually just search for Harvard, search for some of those well-known medical systems, they have good advice as well. You can talk to your local doctor. They are, you know, keeping up on those kind of things as closely as possible. The most important things are probably the things that you hear all the time. Wash your hands as often as possible. Stay in as much as possible. Limit your contact. Stay in, especially if you are sick, and limit your contact with people. Those are the messages that we know for sure are going to work the best.
Cool. Well, most of the rest of my questions are for Dave and Elaine, so feel free to stay on as long as you got time, and chime in, I guess, if you have any insight on some of these.
Okay, sounds good.
All right. So, Dave and Elaine, so I guess the first question I wanted to kind of kick over to you all is, how well has the public in general here been following the rules and sort of what you've been asking, what the CDC has been asking of them? And, you know, I guess as we get into specifics, are there some things that people are confused on that maybe they could use a little more guidance on following?
Well, I think answering the first part of that question is We think that in Cowlitz County, we're also supporting Wahkiakum County and the Cowlitz Indian tribe. So the folks that we're supporting, we think are being actually working very hard to be compliant with the requests as far as guidelines from CDC. Certainly the guidelines that we're putting out, we have very few issues. You know, these are trying times, and right now we're just not having a lot of difficult interpersonal relationship issues coming up. And as far as the response component goes, that's pretty much, as I mentioned to you earlier, that's pretty much into a pretty good, I call it a battle rhythm or a tempo on a daily basis, and projecting out, we don't see any big changes to that. So overall, I think that our citizens are doing a good job, and we certainly appreciate that. It makes it a lot easier for us on the response side to stay focused on these issues you were just talking to the doc about.
Cool. Let's see here. At your level, I know that the IMT is taking some donations on behalf of healthcare workers, first responders, and other people for PPEs. Is there anything in particular that there's really a great need for if people feel like they want to help out, they want to do something to kind of help locally in the county? What's kind of the most crucial equipment you need, or the most crucial things people can do to help?
Well, the most crucial equipment that we need are things like N95 masks, hand sanitizer, gowns, things that frontline health providers and responders are wearing when they're responding to calls and they really don't know what the environment is that they're going into. We are accepting donations, and some of that discussion has centered around the mask that the basic surgical style mask, I'll call them, that some folks are sewing, sewing clubs and stuff are developing. But those also, if they are used, they're used in conjunction with something. For instance, they may be used over another mask that we typically use, so that we don't necessarily have to throw it away as soon as we're done with that one interaction with somebody. So, and all of our donations are being coordinated through the Cowlitz County Department of Emergency Management. So far, I don't know that we've gotten a lot of donations.
I don't believe so. We have some from businesses.
But yes, businesses, the school districts, local industry, they have been very forthcoming with resources. And in fact, we've gotten very little in resources from outside of our own area, which is, we expected that. So we're finding our own supply lines, and we're working collectively so that we're not all competing against each other to try to get limited supplies. We're told that today or early next week, we should get maybe as many as 7,500 N95 masks from the state. But to date, what's kept us going are those donations from those businesses in our own area that have contributed from a PPE standpoint of keeping our folks, the responders and health workers, equipped the way is necessary.
Cool. Let's see here. To get into some compliance issues a little bit, I know that Governor Inslee recently kind of made an announcement having the state take some of the compliance enforcement issues, as far as, reaching out to businesses that people have raised concerns about. So they've taken on a little bit of that role. Tell me just kind of where we stand now, what the IMT's role is alongside the state, if people have complaints about people gathering, about businesses operating. I assume you're still taking those reports and kind of working on them.
Right. We do them locally. We don't send stuff away, and we're not overwhelmed by any means with those. That's what we're informing and educating. That's what our focus is on. And once again, yesterday, I think our folks here looked at about 50 different issues that came in through the Joint Information Center. Of those 50, 42 of them were easily resolved with the phone call. I think about 8 or 9 of them were just figured out to be a mistake somebody made, or sometimes we get some pretty colorful things that come into us that obviously someone's just trying to add some humor to our day. And then they have a couple more that they'll carry over and follow up the next day. But all of our action has been inform and educate. So as far as, and I want to say, our emphasis is keeping businesses open, not how to shut them down or stop them from operating. Yesterday, we had the chance to work with representatives, Ed Orcutt and Jim Walsh. Yeah, Jim Walsh was here. And Jim spent a lot of time here, asked really good questions. And we had Ed and Jim. Ed was on the phone with us on a conference call, and we expressed to them that some of our frustration with interpretation of the proclamation, and asked that those two might carry forward our message, in that our emphasis is trying to keep people working, keep businesses open, and inform and educate is where we're putting our effort.
Gotcha. And so it sounds like for the most part, people are being good about complying. It doesn't sound like have you had to take any kind of like a law enforcement kind of action? I mean, has everyone pretty much been, once they've been contacted, they've been willing to work with you, and they haven't?
We haven't had to take any enforcement action. And again, we're going to do everything we possibly can to not do that. It's a lot of it is perception stuff. Like, you asked us a lot of questions about who should wear masks and who shouldn't wear masks. They did a really good job talking to that. Some of what we see are just questions like, I go to work and my employer's not providing me a mask to wear. Well, that's not necessarily the appropriate action to take. Like, I'll just use you a little bit as an example. Some of the masks and PPE we wear require clean shaven, nothing with the seal. And if you look around, in our society, a lot of people have full beards. And so really, if we're going to implement those kinds of measures in every environment, then we really need to look at some of those other things that contribute to them being successful. Clean shaven, no scars in a seal, nothing that interferes at all. So I think a lot of it is education, is people just understanding that just wearing a simple dust mask it helps if you're sick. It helps prevent you from spreading something, whatever that something is, but that's not protecting you from something that's coming your direction, if that's what you think it's doing. So we're putting a lot of effort into that.
Gotcha. Cool. Let's see here. I think the only other big question I had, same thing I asked Steve, is just at this point, any rumors that you've heard, things floating around that you would want to address or talk about, any kind of rumor control, I guess.
Well, we've had lots of rumors that, black helicopters were coming to town and we were going to set up roadblocks, and, the National Guard was coming for martial law and stuff, but none of that stuff is happening. If If we do get support from the National Guard, primarily it would be in assisting food banks or distribution of resources because we're simply shorthanded. I want to echo and emphasize, be careful what you read on social media, please. But if you want to check facts, go to the CDC, go to the World Health Organization. There's good information there. Certainly our website, we're trying to trim down a lot of that information so that it's easy to read and review. And so our website for the IMT, certainly go to Cowlitz County Department of Emergency Management. They'll route folks to our website if they have questions. I think we have now like 20 pages of frequently asked questions that we have posted so people can look at that. One of the biggest enemies we have is rumors, Alex. I'm glad you asked this question. And people, I heard this morning that somebody had been telling folks that fish are now carrying COVID-19 and bringing it up the rivers. Those are urban legends, and we need to not be spreading that kind of information.
I agree.
Sure.
Stay away from the Facebook wall of text. Don't take it at face value. Do a little bit of research and stick with trusted resources. Washington DOH has a fantastic website. CDC, our website, www.cowlitzcovid19.org. Go to those places to do your fact checking.
And wash hands. I wash my hands so much, I have to use hand lotion to offset the hand washing and the hand sanitizer if I can find it. And so washing hands and staying away from groups of people. And, we're fortunate we don't have the population density in our area that occurs in a lot of other places, especially on the East Coast. Our housing is distributed different. Just in general. So I think that's helping us a lot as this evolves.
Gotcha. Elaine, Dave, Steve, I want to thank all three of you so much for coming on. Like I've kind of said throughout, I'm sure we could spend several more hours talking, and I'll send you all maybe some follow-up questions. But if there's anything we didn't talk about and people do want to reach out to any of you with their own questions, what are some of the best ways to contact you and your organizations?
Certainly through the incident management team through the website. It's
www.cowlitzcovid19.org, I believe.
Or .com.
And then the PIO is a great, at least first stop for that. And it's imt.pio@co.cowlitz.wa.us.
Cool. And Steve?
I'd say that's the same for me. And then, if they have a question that they can't answer and they need my input, they will reach out to me and I'm happy to answer it.
Cool. Any other thoughts from any of you? Stuff we haven't talked about or anything that came up throughout the conversations that you didn't get a chance to mention?
Thanks for the opportunity. I think anything like this helps dispel rumors and try to get good information out.
Sure. Hopefully we can do it again sometime this month.
Okay, good. Thank you.
Sounds good.
All right.
Thanks,
Awesome.
Alex.
Thanks, Alex.
Thanks, guys.
Yep.
Bye.
Bye.